currently I'm sitting in a parking lot waiting for a coworker because she doesn't have a car, so I had to drop her off at this place to do some stuff that's Air Force-y. But today, ladies and gentlemen, is the day that I have my appointment at the hospital. So hopefully today I will know what is wrong with my arm. I just want to have my arm back, and I just don't want to see doctors more. I've seen doctors most of this year because of the nose surgery and the breast reduction and stuff like that. I just, can I leave you guys alone, please? You doctors, I just don't want to see you. No offense, I'm sure you're nice, but like, I don't want to. Boy, if I could stay away from that giant pink building, that would be cool. So I have good news and bad news. The good news is that she doesn't think that I have nerve damage, which is awesome because I was fearing a whole slew of nonsense about like spinal fuckery and like surgery on nerves and that stuff. If there's any chance of coming back from it, after that there's not. But the bad news is that she thinks that the physical therapist was kind of spot on with the CRPS thing. So CRPS stands for Complex Regional Pain Syndrome, which they think I have. It's caused after either surgeries or a traumatic injury, which landing full body weight onto a nerve is traumatic. Her words, also mine. So basically she gave me this printout too of all the things that I can read up on CRPS. So basically what's going to happen from here is that it's going to take a lot of time. I'm going to have to be put on some medication that kind of like dulls your nerves. That way, like, my body can get desensitized and hypersensitive to everything. And then we can start physical therapy again so that I can handle physical therapy and the physical therapy will help. So that's where I'm at now. I'll probably be in physical therapy for quite a long time. So that's cool. Yeah, I start a slew of medications tomorrow to like dull the sensitive nerves. I'm not excited about it. But let's go home. If it looks like I shoved my face and then passed out on the couch, you'd be correct. Bubba.
Yes.
I have a question.
What?
You left and you came back, yeah?
Yes, I did.
During my nap.
Yes, I did.
Whenever you came back, did you bring a bag of Victoria's Secret underwear for me to try on?
Hell no.
Okay.
Since when Walmart has Victoria's Secret?
Whenever you came back, in my sleep, I recognized that you came back. And in my dream, you handed me a big bag of Victoria's Secret underwear and told me to try it on to see if you needed to return any of it. Also, you also brought in 6 boxes of, like, those Capri Sun boxes.
You had a huge dream.
And I asked you, I was like, Bubba, what freaking kids did you buy all this Capri Sun for? You know what you said?
What?
You said, well, if you would give me a grandkid. And then I walked out.
Maybe that's time to think.
Bruh. No. No children from this one.
Oh, yeah.
See that? I done fucked up. So, I have that piece of paper that I was talking about earlier, and I thought I'd, like, read some of the things. with you guys because it's kind of like a learning process for me too, because I didn't know what this was until that physical therapist told me that maybe that's what it is. And then turns out that she was right. So what is complex regional pain syndrome? It's a condition that causes pain, swelling, and other symptoms. It usually happens in just one part of the body, such as an arm or a leg. Yeah. Both adults and children can get CRPS. In adults, it often starts after a bone fracture, an injury such as a sprain, surgery, or a stroke. Doctors are not sure how or why it starts. People who have CRPS have worse pain than doctors would expect from an injury, surgery, or medical problem. The symptoms are pain. The pain can be burning, tingling, throbbing, or aching. It can also be severe, which is what I have. Being sensitive to touch or cold and not feeling any touch or pain normally. Swelling in the body part with CRPS, which my hand swells a lot. My coworkers always go, "Ugh, why is your hand so swollen?" And I go, it's because my fucking arm. Trouble moving the body part due to pain, swelling, or stiffness. Yeah. Tremors and shaking or muscle spasms in the body part. I wouldn't say I have that too much, but it does twitch sometimes. Skin changes. These might include changes in skin thickness, temperature, or color, or sweating more or less than usual, which it does kind of sometimes turn purple. So that's fine. And then the last one is changes in the way the hair and nails grow, which I haven't noticed any difference, but is there a test for CRPS? No, there is not just one test a doctor can do to find CRPS. The doctor or nurse will do an exam and ask questions. He or she can usually tell if a person has CRPS from the symptoms, medical history, and exam. If a doctor is not sure if a person has CRPS, he or she might order imaging tests such as bone scan, x-ray, or MRI. Doctors can also do tests that measure skin temperature, sweating, and nerve sensitivity. These tests are not usually needed. The doctor might do them if he or she needs extra information. How is it treated? Treatment for CRPS is different for each person. Doctors can try different treatments to see what works best. For adults, the treatments include learning about CRPS, talking with a counselor. This can help reduce stress at work or at home can be part of CRPS or make it worse. Physical therapy to learn exercises and stretches and keep the body part with CRPS working. Why are you yelling at me? Excuse me, Wayne. What do you want? And taking medicines to relieve pain. These can be prescription or over-the-counter medicines depending on what the doctor or nurse thinks might work best. Which the doctor did prescribe me gabapentin or Neurontin, which was originally created as a seizure medicine because it basically targets aggravated nerves in the brain, or aggravated nerves in the brain to calm them down to reduce the risk of seizure is what I was kind of told. So kind of same thing, it'll just target the nerves in my body and calm them down. That way it's not as sensitive whenever I try to bend it or straighten it or it gets touched or just being there in general. That way whenever I start physical therapy, it can start taking effect and actually working rather than me just crying in pain and them not being able to do anything with it. If these treatments do not help, people with severe CRPS could see a doctor who specializes in treating pain. These doctors might try other treatments such as injections of numbing or pain relieving medicines, pain relieving medicine given in the spine, which is horrifying, devices to help stop nerve signals of pain. Can complex regional pain syndrome be prevented? Sometimes. Taking vitamin C after breaking a bone or having surgery might help prevent CRPS. Which, if that is the case, I use vitamin C every single day, and that does not work. Thank you. Maybe it is just in skincare, but still, it all goes in. It all goes in. In adults who have a bone fracture, injury, or stroke, keeping a body part moving can help prevent CRPS. Well, whenever they thought that my arm was broken, they told me not to move it for 2 weeks. So that kind of screwed me over, and now it's basically frozen in place. So, cool. Okay, so basically, hopefully, this medicine that she's going to give me works, and eventually I'll be able to handle physical therapy. We'll get my arm, my joint, and my nerve working and moving to get back into use. And then hopefully one day I'll just be able to use my arm again. That'd be cool. But if this doesn't work, then the next step is basically trying all the types of medicines that they possibly can give me. And if that doesn't work, it'll be injections of numbing or pain relieving medicines, pain relieving medicine given in the spine, devices to help stop nerve signals of pain, which I heard includes surgery, killing the nerve, so on and so forth. And even if they do kill the nerve, I'll still have to go to physical therapy to get the joint back into motion and not frozen anymore. My biggest concern is the whole, how it says devices to help stop nerve signals and pain relieving medicine given in spine. Since it is nerve stuff, possibly, if it's not just CRPS, I don't know. There's a mixture of the two, I guess. They go hand in hand. I've read other places than just this that they go into your spine and like put a little computer to see how the nerve is reacting, and if it's okay, they go in and they see what is wrong with the nerve surgically, and then if it's still not working, they go and just kill the nerve altogether. And all that horrifies me beyond belief, because once you kill a nerve, it doesn't come back. So any hope that you had is gone. So I guess we're just gonna take it one step at a time. Tomorrow I pick up my medicine from the pharmacy, and slowly I up the doses over 3 weeks. So we'll see if it works. So I guess I have CRPS, guys. Moving on to a happier note, something that I've forgotten to do for like a couple days is candy. Why are you yelling at me, Ween? You're so rude. That's not for you, Ween. Okay, today is Vlogmas Day 8. So I have 5 done, so I need 6, 7, and 8. Look at that. Do you want 1 or 2, Bubba?
What?
Candies.
1.
1. So here's 8. It's a dairy milk. You'll probably like that one. Or maybe it won't be enough for you. I don't know, since it's not bad. A Cadbury cream egg. That one is mine. I'm claiming it now. Where's number 6, Ween? And a Whisper. Hell yeah. That's the one I've been waiting for. Zoella talks about this one. She likes that. Whisper first. Yeah, that's good. I don't know. It's just, it was basically kind of plain chocolate. I don't know. They don't say anything on here about it. It just says like the name. Like that one just said Whisper. Man. Cadbury knows what they're doing. I needed that after today. And for those of you who have been asking, that was English. I'm not doing the Charlie Brown one. Screw him. I mean, don't screw Charlie Brown. That's inappropriate. Don't screw Charlie Brown. What I mean is like screw that thing, because I thought there would be candy in it first, so I was like, oh, well, now there's no candy, but at least it'll be something cute, right? Like little comics. And that turned out not to be little comics, and now it's giving me a fucking to-do list for Christmas, and I just don't want it. Got enough on my plate, you know? So we're gonna leave him. He's just gonna be pretty. I'm gonna end the vlog here, guys, because I don't know if you can tell from the bags under my eyes, but I'm still sleepy. So I'm gonna go sleep soon. I hope you guys are having a wonderful holiday season, whatever it is that you celebrate. And, yeah. Hope you like this, and I'll see you tomorrow. Say goodbye, Ween. Goodbye, Ween. Oh, yeah, she waves. Goodbye, Ween. Goodbye, guys. Have a good night.